Good evening. My name is Angie Williams. I work in the Guidance and Counseling Department. Thank you for being here. We're so glad that you're able to come tonight. If you're joining us online, and those of you that are here in person, we just want to welcome you and thank you for being here as we address this incredibly important issue of suicide prevention. We're very fortunate to have two Frisco ISD district counselors here tonight to share with us their insights and expertise on suicide prevention, mental health, and how Frisco ISD delivers mental health and suicide prevention curriculum to our students. Tonight we'll learn how to better identify warning signs, assist those facing mental health challenges, and provide necessary supports for our children. Jackie Kaspari is one of our speakers tonight. Jackie has over 20 years of experience in education, working at all levels from pre-K through 12th grade. She spent 7 years as a teacher, 7 years as a campus counselor, and has served as a district counselor for the past 6 years. Additionally, she is an LPC associate and practices privately. We also have Melanie Smith, who holds a Master of Science in Counseling, is a licensed professional counselor. Since 2018, she has served as a district counselor for Frisco ISD. And prior to joining Frisco, Melanie worked as an LPC at a high-risk elementary school. She has served as a therapist with Easter Seals. She's provided applied behavioral analysis therapy to children with autism and gained experience in her private practice. So welcome again. We're glad that you're here, and we'll get started.
All right, well, thank you all so much for coming. We're really honored to be able to go over all of this with you and help partner with all of you in our community to help make sure that our students are staying safe and becoming more resilient. So tonight we're going to be talking about how we can assist children and teens facing mental health challenges, promoting protective factors to increase mental wellness in children and teens, and also go over our suicide prevention program in the district. This is some data that we have from the CDC about mental health disorders and suicide in children and teens. So 20% of children in the U.S. have a diagnosed mental, emotional, behavioral, or developmental disorder. Almost 16% of high school students and 8% of college students in the U.S. have seriously considered suicide. Nearly 10% of high school students attempt suicide each year. And suicide is the second leading cause of death among youth ages 10 to 24. This is some data that we have in Frisco ISD. This covers anything from self-harm to suicide, thoughts of self-harm, thoughts of suicide. Whenever we have a student come to us or come to a counselor, we fill out a form and it goes to the parent, and that's how we get this data. If you'll see the bold numbers, that's the data from last school year, so 23-24. The numbers in parentheses are from the prior school year, so 22-23. If you look at the elementary numbers across the board, they are fairly high, especially with suicidal ideation and suicide attempts. One good thing, though, is that across the board, things are starting to decrease. So we've had a 2% decrease overall in the past 2 years. This is our hospitalization data for FISD as well. We have a lot of students that go into treatment facilities to get help if they're having some mental health crises or if they're having self-harm or thoughts of suicide. Again, the numbers in bold, that is from last school year, 23-24. The numbers in parentheses are from the previous school year, which is the 22-23 school year. We have students that go into inpatient, which can be about a week to 10 days. We have outpatient care and residential, which is very long-term. Again, we're seeing an overall decrease in all of these numbers. This shows us the hospitalizations by grade level. It's pretty apparent that going to secondary grades, so 6th grade through 12th grade, is when we see an increase in hospitalization in our students. But also all the way down to 1st grade, we have kids being hospitalized then as well.
So as is the case with physical health, mental health is on a continuum, and the degree of any person's mental wellness fluctuates. It goes up and it goes down. So how do we know when a young person or teen is struggling with their mental health? There are many signs that we can look to, and these warning signs are going to indicate us that your child or your teen may be struggling. These really are new or changed behaviors. Warning signs can be in the form of what they express, how they behave, and then also the emotions that they show. As parents, we need to know, what is our child's normal? What is their baseline? What is a typical behavior or emotion or thought pattern? And when those change drastically, that's when it's cause for concern. The very best thing that we can do as parents is to pay attention and tell our kids that we are observing a change. Something is different. Please tell me what's going on. I noticed this. I observed that. What can you tell me? We know that ignoring is never the best answer. And so some of the signs that a child might be struggling, first of all, a physical sign such as changes in appetite, sleep pattern, fatigue or lethargy, just really being low energy. Sometimes it's poor health or lack of interest in their appearance or their hygiene. We also see some psychological signals of distress, and these can include a persistent sadness, unstable emotions, helplessness, trouble with decision-making or focusing or concentrating, and then lastly, increased anxiety. For behavioral changes, you might see some withdrawal, maybe staying in their room more often or not being with friends, changes in their personality or giving away prized possessions, self-harm behaviors, which we'll talk more in detail in a bit, some substance abuse, and some increased compulsive behaviors. One of the things that Melanie talked about at the beginning was the importance of the partnership between school and home. And so teachers and school personnel might notice some changes in your child and share that with you as well. They might report things like misbehavior where there wasn't misbehaviors before, frequent tardiness or absenteeism, lack of motivation, detachment, pulling away in class and from peers, a sudden drop in grades, an extreme change in mood, some emotional or behavioral outbursts, a flat affect, so really not having a lot of expression in their face when they're feeling an emotion, and also changes in appearance, and again, sleepiness in class is another sign. We can also look at warning signs. And again, these are new or changed behaviors, expressing thoughts of wanting to die or killing themselves. This can come in the form of saying them out loud, or even writing them in a journal or in their English class. Sometimes we see these cries for help and these expressions of wanting to kill themselves in dark artwork or posting on social media. They may also make comments about what it would be like to be gone or feel that they're a burden. They might say things about it would be easier to not wake up and live anymore, or talk about seeking revenge. I'll show this person. I just won't be here tomorrow. Sometimes they might express feeling trapped or in unbearable pain. And then some warning signs that are behaviors would include, again, sleeping too much or too little, increased substance use, whether it's alcohol or drugs, researching methods and ways to die, seeking means, trying to find weapons or get their hands on medications, for example. Sometimes a warning sign can be a sudden painful event that they say they just don't think that they can get over. We also sometimes see withdrawing, self-isolating, and reckless and risky behaviors. Some emotional warning signs include extreme mood swings, rage, acting anxious or agitated, overly emotional, and again, not showing much emotion, having a flat affect. Next, we're going to talk about, thoughts of suicide aren't always obvious. So we want to definitely be looking for hinting at suicidal thoughts and statements. Sometimes they'll say, I want to die, but sometimes it might be less direct. And so, again, we want to ask the right questions and be curious and let them know that we're listening. They might say things like, I feel trapped, or I need a way out, I'm a burden, what's the point in living anymore? I see no future, I need to escape my thoughts, or nothing will get better, I can't bear this pain. Some important risk factors for suicide. These are different than warning signs. Risk factors are characteristics that a person has that puts them at greater likelihood of suicidality. I just want to say, first of all, males are at the highest risk for suicide attempts and completions. In 2022, men died 3.85 times more often than women. However, women attempt 2 to 3 times more often. So we know that men tend to use more lethal means, specifically firearms, and women tend to use more nonviolent means, such as medications. And so that's the difference in the lethality. Another thing that really speaks to the importance of safety of weapons is that in 2022, firearms accounted for almost 55% of all suicides. So gun safety is at the forefront of suicide prevention as well. So some of these important risk factors include previously attempting suicide, an ongoing exposure to bullying, physical disabilities or illness that are long-term and lasting, a history of substance abuse, relationship problems, losing another close loved one to suicide puts someone at much higher risk. Losing or having a history of a mental health condition, and any recent death or loss, as well as having access to lethal means such as guns.
So now we're going to address some protective factors to help kind of combat the risk factors that Jackie just talked about. One of the biggest protective factors that we have is connection, and that's making sure that our students are connected to family and friends and teachers and community and just people that can be of support to them. If you'll see up there, that's the first one on our list of protective factors, which is strong connections to family and community. Another protective factor is life satisfaction. We're all going to have bad days, and that's okay, but we want to make sure that overall that we are happy with the way things are going, and that's one thing that's going to help create some resiliency in our kids. A sense of family responsibility. So that's kind of being more connected to your family and not wanting to leave them behind. Effective problem solving and conflict resolution skills, cultural and religious beliefs, reality testing ability. So that means knowing that because something bad is happening right now, it's not the worst thing that could happen, and knowing how to decipher between rational and irrational thoughts. Access to effective clinical care, so making sure that we are providing resources and that children are getting access to those resources. Having emotionally supportive connections with providers. We want to make sure that they feel connected to that provider. If they have a relationship with them, it's going to be much more helpful. And then again, restricted access to highly lethal means. I think that's the biggest one. Here are some things that you can do at home to create some protective factors with your own child. So provide a physically and emotionally safe environment. We want to make sure that our kids are able to be open with us at home, come to us if they are having trouble with friends or school or their own mental health, and that they feel like they can trust you and rely on you to be able to open up to you about these things. And also make sure that they are physically safe in the home environment as well. Emphasize purpose and growth mindset, not perfection. So perfection is not real. No one can be perfect, and that's something that we want to make sure that a lot of our kids know. As long as they have a goal and they're working towards it, just making sure they realize that they will, perfection is not something that everyone has. Knowing your children and their baselines to identify when they are at risk. So Jackie talked about that earlier when she was talking about the risk, the signs and symptoms, and just knowing what your kid's normal is. So if You have a student that normally has a good sleep routine and a good appetite, and all of a sudden now it changes. That is a change from their baseline for them. Foster self-esteem and emphasize all children's strengths. We want kids to be confident in themselves and happy with themselves and know that they are successful and that they are, good at the things that they like. Promote peer connectedness. So again, there's the connection piece. We want to make sure that they have connections with friends. And that doesn't mean just online or video games. We want them to be connected in person as well. And just to make sure that suicide prevention happens every day. Some other protective factors are making sure that they have coping skills to be able to handle these difficult feelings that sometimes come up. So some ways that we can help them to release these difficult feelings are to, they can cry. That's actually very healing. Talking about it, writing about it. If they want to journal, if they want to write about it and then throw it away, that's fine. Something that I always say is when they journal about it, no one's judging what they're saying. They can write down whatever they're thinking. Using art to create, scream or laugh. Making sure that they have good hygiene. So drinking plenty of water and eating healthy foods, making sure that they are getting enough rest. Being active, so you can walk or run or dance or go play sports with friends or games with friends. Be kind to yourself. Make sure that you're talking kindly to yourself. So those inner thoughts that we have, we want to try to keep those as positive as we can. And to be able to talk to a trusted friend or an adult if they need some extra support.
Okay, now we're going to talk about suicide prevention and what we do in our district. We've kind of talked about, give me 1 second, I've got to find my notes, I'm sorry. My apologies. Okay. In our district, we are very much focused on prevention. We know that a pound of prevention is worth, or an ounce of prevention is worth a pound of cure. And so for all students, we are about education and prevention. And this looks like so many things. Guidance lessons, teaching them coping strategies like Melanie was talking about. Helping them to identify their strengths. We do that in elementary. Tier 2 and Tier 3 are really more about direct suicide prevention, and we only do that with secondary students as mandated by Texas Education Code. And then every month we have a character strength that we highlight in our district, pre-K through 12. We share this with our families in newsletters. We have guidance lessons on our campuses, and we have advisory time and classroom meetings in elementary and middle school where we talk about how difficult feelings and difficult situations are chances for us to practice these character strengths of grit and perseverance and gratitude. And this kind of helps our kids in a group setting as well. You know, when then they're in that advisory classroom or they're in a classroom meeting, it fosters relationships and connection at the same time as it's teaching them valuable skills for emotional resilience. We also have state-mandated training. So these are all provided to our staff and our students every year. Bully prevention, anti-victimization, suicide prevention. We teach our staff trauma-informed practices in the classroom. And we also have substance misuse prevention at all levels. All of this factors into protective factors to keep our kids safe and mentally well. We also promote mental health and wellness by helping create a climate and a culture that is positive. Again, we want kids to feel happy they're at school and connected. And school connectedness is the belief that others at school care about you, and they care about your success as well as your well-being. When youth feel connected to their school, they are much less likely to experience mental health struggles. So these are some of the things that we do. We have student ambassador programs, and student ambassadors are in our secondary schools, and they are liaisons between the students and the administration, and they kind of have a pulse on the school and where improvements can be made. And we offer clubs and organizations. We also give something called the Safe School Survey to all students. They take that survey and they tell us what is going well at school, what needs improvement, and our district responds to those, again, to always look for ways to make a more positive climate and culture. Our employees throughout the district, including teachers, also receive an employee behavioral health survey because we know that part of a healthy school is healthy employees and teachers, and so there are district processes in place to respond to those needs as well. You will find flexible seating and cozy classrooms to help bolster morale and mental health in our kids, and also music during passing periods. And some of those things seem kind of small, but they actually do add up. Our program, like I said, at the secondary levels is based on a program called SOS, or Signs of Suicide. It is TEA approved. That's the Texas Education Association agency, rather. It's research-based, and it's proven to be effective. And it's based on the acronym ACT. And so we teach every year before school starts. We remind and we retrain all of our counselors, teachers, and staff this protocol, and then we also teach it to all of our secondary students. So acknowledge. When we acknowledge that someone has expressed to us that they're thinking of harming themselves or they're thinking of suicide, we validate them. We don't dismiss what they say. We don't try to talk them out of it. We might say something like, "I am so sorry that you're going through this. This sounds really hard." Also, we care. We show that we care by listening. And listen, sometimes as parents, it's hard to hear our child say these words or discover that they're really struggling. But we can't help them if we don't listen and care and let them know that we are there to offer support and help. And then lastly, we tell. So we let our students and our children know we're here to help you, but we're also going to tell some providers. We're going to tell your school counselor so that they know that you're struggling. We might even talk to your pediatrician and tell your pediatrician that you're needing some support, and also look into some counselors for you. Here's some words to use. So as a parent, you might say, "You've really been spending a lot of time in your bedroom lately. Are you okay?" So again, that's that withdrawing piece that we might see. Or, "Are you okay? You really don't seem like yourself." "You've seemed irritable lately. Is everything okay?" Or, "It seems like you're not as motivated lately. What's going on?" These are just some examples of words to use. And furthermore, we want to be careful how we approach and the language that we use. We don't want to say to our child or our teen, "You don't mean that," because we want them to know that we're listening and that we believe that they really are in pain. And we definitely don't want to say, "Don't say those things," because then that shuts them down and they won't come to us the next time they feel that way. We don't want to say, "It can't be that bad," because in their world and in their perspective, it is that bad for them. So again, we want to validate. And we don't want to say, "I understand exactly how you feel. When I was a kid, it was really hard," because then that makes it about us, and they, again, aren't going to open up. We also don't want to say, "Think of the positive and all you have to live for," because that minimizes the struggle and the pain that they're going through. We don't want to launch into, as often parents we try to do, "This is what you should do. Here's how you fix this." We just want to be there and listen. And if we ask, "Why didn't you use your coping skills?" sometimes that feels a little bit judgy for them. And again, they might put that wall up and stop talking. If a child is actively suicidal and talking about harming themselves, you don't ever want to say, "I'll be right back," and leave them unattended. You always want to constantly supervise. Now, here are some things that we can say that are helpful. What I heard you say is that right? Do I have that correct? Or tell me more to sympathize with them. Or you must be really upset and in a lot of pain, and I'm so sorry you're going through this right now. Or perhaps, please know that there is hope. I'm so glad that you had the courage and trust to tell me this. And then back to the tell piece, we're going to need to get you some help. We need to tell somebody that is an expert that can help us with this. And then lastly, I'm going to check in on you regularly because you are so important to me, and I want you to know that I care about you. Some more considerations surrounding suicidality are the following. First of all, that suicide and thoughts of harming oneself are really a thinking error. It has to do with emotions, but it also is intellectual, and the affected person really does not see a way out of the situation. And so for some, thinking about suicide can actually become its own coping strategy where they have an exit plan in case. They feel so helpless and hopeless that they are just wanting to keep that idea as an option. As I said before, we want to keep things transparent. We want to keep our children and our teens coming back and talking to us. So we never want to say, don't say that, stop talking about that, because that puts the problem and their emotions underground and secret, and that's what we don't want. We do want to consider asking, do you want this pain to stop? Do you want this thing that you're going through to get better? Is that what you want to end? Because that's different than wanting your life to end. And again, we don't want to push this problem underground. Lastly, it's important to know that suicide is very multidimensional. It's biologic, genetic, psychologic, sociologic, and there are environmental factors. And because it's so multidimensional and because it's so complicated, no one person or event can cause someone to end their own life. And a completion of a suicide is really the result of many, many, many factors. 90% of people who die by suicide had some kind of diagnosable disorder, but many of them did not have a formal diagnosis, and the warning signs are not always there. I tell you that because sometimes it feels judgmental when we talk about suicide prevention, because really what it is it's drastic suicide reduction. We all really hope for a day when suicides don't happen, but we also know that they do, and we want to reduce them, and we want to treat every one of our children's life as if it is preventable.
Good morning, and welcome to the suicide prevention lesson for the 2024-2025 school year. Last year in Frisco ISD, hundreds of students reached out to friends or trusted adults on behalf of themselves or someone else who is experiencing a mental health crisis. This takes courage, and we want to begin by personally thanking you for helping end the stigma, for being part of the solution, and for saving lives. We belong to each other, and we all have a shared responsibility to care for one another. At the end of this training, you will be able to identify healthy daily habits that lead to strong coping strategies in mental health, notice mental health warning signs in yourself and others, act to help yourself and others, and seek help from a counselor, trusted adult, or friend when needed. Difficult feelings come and go, and we all deal with them from time to time. There are many ways to cope with difficult feelings. We can release the difficult feelings by crying, talking, writing about them, creating, screaming, or laughing. We can take good care of ourselves by staying hydrated, eating healthy foods, practicing healthy hygiene, and prioritizing rest and sleep. We can also get active by walking, running, dancing, or playing sports with friends. And be kind to ourselves. Make sure to speak kindly to yourself. Don't expect perfection, take a break, and do things that bring joy. Talk to a trusted adult or friend. It's okay to ask for help and get support for you or a friend. There are some warning signs that you may notice in yourself or others that could be a sign that someone is having thoughts of suicide. Some of these warning signs include talking or posting about wanting to die or not be here anymore, feeling like a burden to others, no one noticing or caring if they were gone, sending goodbye messages, feeling hopeless, or talking about death often. You might notice that someone is acting differently when they begin isolating from friends, eating or sleeping more or less than usual, not caring about things they used to care about, using drugs or alcohol, giving away their belongings, engaging in unsafe, risky behaviors, and researching or planning ways to die. You might also see changes in mood, such as being more irritable and reactive, feeling angry and lashing out, having a flat affect and not expressing any emotion, feeling anxious and nervous, feeling sad more often than usual, or drastic changes in mood. Suicidal thoughts and statements may be direct, such as, "I want to die." Sometimes, though, they are less direct and may contain hints. Examples of less obvious suicidal thoughts or comments include phrases like, "I feel trapped," "I need a way out," "I am a burden," "What's the point in living?" "I see no future," "I need to escape my thoughts," "Nothing will ever get better," "I can't bear this pain anymore." The acronym ACT is a simple way for people to remember how to respond when someone opens up to you about thoughts of suicide. ACT stands for Acknowledge, Care, and Tell. When we acknowledge, we validate rather than dismiss their thoughts and feelings. It can be difficult for someone to bring up suicidal thoughts, and if you don't take them seriously, they may shut down and not come to you again. Show that you care by listening carefully and taking what they say seriously. It might be hard for you to hear, but listen without judgment. You can't help them if you don't know what they're experiencing. It might also be beneficial to ask them how you can help. You may not know what to do, and they may not either, but offering to help and asking what they need can be a great first step in expressing you care. Tell a trusted adult or mental health professional about their struggles and encourage your friend, family member, or coworker to seek treatment. There are many ways to use ACT and offer words of support to your friends. You might say, "Hey, we haven't talked in a while, how are you?" Or, "Are you okay? You don't seem like yourself lately." You could also say, "Whenever you're ready to talk, I'm ready to listen." You may be asking, how do I know when it's time to turn to a trusted adult? This can be tricky, but there are some strong indications that you need to involve a grown-up. If you feel like your friend is unloading some heavy stuff on you, or if you have concerns about safety, if the situation feels too grown up for you to handle on your own, or if your own mental health is being affected by the weight of supporting your friend. As a rule, it's always better to be safe than sorry. If there are any concerns about safety whatsoever, go to an adult. If your friend is hurting themselves, talking about hurting themselves, or showing signs that they might hurt others, then it's important to seek help. If the situation feels more adult than you should be dealing with, it's probably time to consult a grown-up. Any sort of gut feeling, any reaction you have that this doesn't feel right, or if you feel like you might be too young for this information, then it's important to go to someone at school or directly to your friend's parents. If your mental health is being impacted by the weight of this friendship, then you should talk to an adult. Whether you feel increased anxiety, are showing signs of depression yourself, or are considering self-harm, it's definitely time to get help for both yourself and your friend. One of the biggest barriers to seeking help can be fear of betraying a friend who has trusted you with sensitive information. There are ways to do this without it seeming as though you are tattling. Make sure you are open and honest with your friend. Share why you feel it's time to bring in a grown-up. Let them know why you are concerned and that you feel it's time to seek additional support, because you care. You can also offer to go with your friend to talk to an adult if that would help them feel more comfortable and supported. Even if your friend asks you not to tell an adult, keep in mind that your friend's safety and well-being is what is most important. If it is difficult for you to share your friend's information with an adult when your friend has confided in you, remind yourself that it is normal to worry about how your friend might react to you telling an adult, but telling an adult is what is best for your friend and for you. If you are at school or at a school-sponsored activity, follow these steps to act and help a friend or classmate. First of all, always take their cry for help seriously. Listen and be there for your friend. Never keep a suicidal outcry a secret, and do not promise to keep it a secret. Make sure you or someone else stays with your friend or classmate to make sure they are safe. It's critical that you immediately and in person notify a teacher, counselor, or other adult in the school. Lastly, in the days and weeks following the incident, keep checking in with your friend to let them know you haven't forgotten that they are going through a difficult time and that you care about them. Even if you and your friend are not at school, it is still critical to make sure your friend stays safe. Always take their cry for help seriously. Listen and be there for your friend, and never keep it a secret. Immediately notify your friend's parents or an adult by phone or in person. Never rely on an email or text. Call the police department or 911 if you can't contact your friend's parents, and continue to check in with your friend and let them know you care. Even though it may feel like you are alone, there's always someone you can reach out to for help. One option is a trusted adult. This includes a parent, teacher, counselor, a coach, family member, family friend, a friend's parent, or an AP or principal. Another option is to talk to a friend. If you are unable to reach anyone you know, please call or text the National Suicide Lifeline at 988. Licensed counselors are available to help 24 hours a day, 365 days a year. If you or someone you know is experiencing a mental health crisis, call or text the National Suicide and Crisis number 988 for a free confidential conversation with a trained counselor anytime. If a mental health crisis results in a medical emergency, or if there is immediate danger of harm, call 911 and explain that you need support for a mental health crisis. This world is better with you, your friends, and your classmates in it. We belong to each other, so remember to acknowledge, care, and tell. After this presentation, you will see a QR code or a bit.ly. Please scan the QR code or enter the bit.ly that will take you to an exit ticket. Please answer each question. Check the answer and best describe how you are feeling right now. This is not a quiz and there are no right or wrong answers. Please answer honestly. Make sure that you are signed into your Frisco ISD student account to complete the exit ticket. This form is not for schedule changes, academics, or grade concerns. For those issues, please submit a separate request to see your counselor. Thank you for your attention, and more importantly, we thank you for continuing to care for yourself and others by knowing the signs and acting on them. It saves lives.
The lesson that you just watched is our student suicide prevention lesson that goes out to all secondary campuses. Parents receive an email about a week or two before the lesson is shown, and if you would like to opt your student out of the lesson, you are able to, and then they will go to a different room. That way they are not seeing the lesson happening. The exit ticket that happens, it goes straight to the counselors. No one else sees it. The teachers don't see it, the friends don't see it. It's very confidential, and if your student feels like they need somebody to talk to, the counselor can call them down and check in with them that day. This is our suicide prevention protocol in the district, the guidelines that we follow. These are the guidelines for staff, so teachers, coaches, directors, anyone that works with students on campus. If a student comes to a staff member on campus, or it is reported to a staff member that a student is having an outcry of self-harm or suicide, these are the steps that they will take. On campus, of course, they will use the ACT protocol, which we talked about earlier, to acknowledge, care, and tell. They will make sure that the student stays supervised at all times. So either that adult will stay with the student, or another adult will come and stay with the student. The staff member will then reach out to a counselor on campus or an administrator. Either the staff member will walk the student down to the counselor, or another adult will come get the student. That way they are not by themselves on campus. And the staff will also follow up with the student after the counselor has checked in with them. If they are off campus, so this would be a sporting event, a fine arts event, a field trip, anything like that where school is not in session and they are off campus, again, they will follow the ACT protocol and make sure that the student stays supervised at all times. They will reach out to the parent and have the parent come and pick up the student to make sure that they stay safe. If the parent is not able to be reached, and it is an emergency, then they will call 911 to come and do a check on the child. They will then notify the counselor or administrator and make sure, again, in the following days that they follow up with the student. If it is after hours, this would be a situation where maybe a teacher checks their email in the evening or on the weekend, and a student has emailed them something that feels concerning. Again, they're going to use the ACT protocol, and then they're not able to supervise the student, but what they're going to do is respond to that email to try to engage with the student. While they're doing that, they are going to contact the first person on the student's account to check on the student and put eyes on the student. If they are not able to get in touch with someone, then they will call 911 to do a well check at the home. Again, they will notify the counselor and follow up with the student. This is our counselor protocol. So if we have a student brought down to us or we are notified that something is going on with the student, the staff member will bring them to us or we will go get them and we will check in with the student. Once we talk to the student and we kind of find out what's going on and make sure that they are safe and that they are okay in the room with us, we will reach out to the parent or the guardian and let them know what is happening. There is a Columbia scale that we fill out for the student that asks a series of questions to determine the severity of what they are going through. When we fill out that Columbia scale, we also fill out a questionnaire on a form that will be sent to the parent. The counselor will talk to the parent, then they will send that form out. It also has a list of resources at the bottom for you to use to take your child to a therapist or if they need to be evaluated. When the student comes back, if you come and pick them up or if they are taken to a treatment facility, a safety plan will be completed and that will be shared with you and their teachers. If it is off campus or after hours, similar to kind of what the teachers or the staff would do, the counselor will make sure that the student is okay, and they will try to engage with the student if it is through email. And again, they will contact the parent. Then they will fill out that harm to self form, which asks the series of questions, and the Columbia scale questions, which will be sent to the parent. And then when they come back, again, they will fill out that safety plan, which puts in some coping strategies or things that can be done for the student at school to make sure that we're keeping them safe. We've talked a lot about following up with a student, whether that's you following up with your child, staff is following up with them, the counselors, friends, whoever it might be. This is some data coming from the Suicide Prevention Lifeline. So when a student or anyone reaches out to that 988 number, a licensed therapist is who will speak to that child on the phone. And this is some data showing how following up with them can help keep them safe and prevent another outcry from them. So it says that 53.7% said that when a counselor called them or checked up on them, it kept them from attempting suicide a lot. And then 25.1% said a little. When asked to what extent that the counselor call or check-in had kept them safe, it was 60.8%. A lot, and 29.3% indicated a little. 59.8% reported that just getting or anticipating getting the call or knowing that someone cared and was going to check in with them was very helpful. We have some scenarios here for you to be able to work through and kind of figure out what you think you should do. So let's say one evening at dinner time, your child comes and tells you that their friend is on the phone. Their friend says that they are thinking about suicide. You do know this friend's parents, so what do you think that you should do? I'll give you a minute to go through that and think about that. So you will first of all reach out to the parent. You will call them. Don't text them. Don't email them. We want to make sure that we're always either talking face-to-face or talking over the phone. If the parents don't answer, then you want to call 911. You can give them the parents' information, the student's name, and just ask them to do a welfare check and give them as much information as you have. This is the second scenario. Your child wakes up in the middle of the night. They have just seen a social media post from a classmate or acquaintance who hours earlier stated, "I'm going to end it now. Goodbye to all my friends. I love you." So what would you do in this situation? You would go ahead and call 911 and give the student's first and last name or as much identifying information as possible. So again, 988 is our suicide prevention lifeline. If you or someone you know or your child or anyone is going through a mental health crisis or is having thoughts of self-harm or suicide, they can call or text that 988 number and they will be connected with a licensed professional to talk with them. All right, well, thank you guys so much. This are Jackie's email address and my email address. If you have any questions whatsoever about the information that you heard tonight, you can email us with questions and we will get back to you as soon as possible. Thank you.